You might be surprised to learn that your mouth can reveal an awful lot about just how healthy you really are. Stick around to find out more. Well, hello again, folks, and welcome back to another Dentistry Made Simple video. My name is Dr. Kenneth Goods, and I'm a retired dentist from the state of South Carolina here in the U.S. So I've mentioned in several of my videos that our bodies function as a whole unit and not a bunch of separate compartments. And there's a lot we can learn from our own mouths, including information about the state of our body. Here's a look at some health conditions your dentist may be able to identify simply by looking in your mouth. Let's begin. If you suffer from allergies like I do, then you know all about the itchy eyes and sneezing. But allergies can also cause changes in your mouth as well. It's very common to have tooth pain, especially in your upper back teeth, as these teeth sit very close to your sinuses. That sinus pressure can definitely make your teeth hurt. If your nose is stuffed up, you'll likely end up breathing through your mouth instead, leading to a dry mouth. A dry mouth leads to less saliva, and less saliva can mean more cavities. Not getting enough sleep? Talk to your dentist. Yes, your dentist. A dentist is often the earliest detector of sleep disorders. Often missing teeth, clenching or grinding of the teeth, mouth breathing again, or being high risk for cavities are linked to poor sleep quality. Your dentist can notice these signs and symptoms early, so don't be shy about letting them know if you're having trouble sleeping. We're back again with teeth grinding and clenching, a classic symptom of stress. This can lead to D.M.D disorders. I made an entire video on this very subject, which I'll link to here. People suffering from stress can also have higher incidences of gum disease as well because of this stress causing grinding. So please don't ignore this one. Up next is heart disease. Did you know that complications such as a heart attack and stroke have been linked to tooth loss and gum disease? That plaque that builds up around your teeth is the same plaque that clogs your arteries. Gum infections are more common among people with coronary heart disease, so please stay current with your dental cleanings, please. Type 2 diabetes is another condition that makes an appearance in the mouth. That excessive sugar or glucose can cause oral health issues. Since saliva contains glucose, too much of it will allow harmful bacteria to settle in the mouth. This will lead to that sticky plaque which causes cavities and bad breath. It can also progress into gum disease as it tends to reduce blood flow to the gums and bone. The good news is that when you treat and control your diabetes, the condition of your mouth improves rapidly. Women trying to get pregnant will often show signs in their mouths even before that pregnancy test lets you know. The hormonal changes going on in your body can weaken your ability to ward off harmful bacteria, leading to, you guessed it, bleeding gums and possible gum infections. In fact, we dentists will refer to this as pregnancy gingivitis. If you've always had healthy gums, but now they're bleeding, and you're trying to have a child, well, you just might have gotten your answer. Congratulations. Nutritional deficiencies are another classic condition often making its first appearance in the mouth. Malnutrition can lead to poor oral health, including how your teeth erupt, how our enamel develops, and how strong our gums will be. A lot of people don't get enough vitamin D. Going outside in the sun for about 15 minutes is usually enough to have our bodies make enough vitamin D. But a deficiency is linked to gum disease, tooth defects, and cavities. Are we noticing a trend yet here, folks? How about osteoporosis? Most of the time, we associate this condition with the elderly falling and breaking a hip or something. But did you know that tooth loss can sometimes be attributed to osteoporosis? This disease causes low bone density, which ends up weakening the bones. Weak bones in the jaw means teeth are no longer anchored in a solid foundation. They start getting loose and can end up falling out. And finally, eating disorders can cause extensive damage to the teeth and the rest of the mouth. and is easily detected by your dentist or hygienist. In bulimia, there's a lot of tooth erosion due to the acidity produced from excessive vomiting, especially on the tongue side of the teeth. A large number of individuals with eating disorders will also consume large quantities of junk foods high in sugars. So an unusual amount of cavities is also a clue that something serious is going on. Friends, please don't overlook any unusual changes in your mouth. Things like bleeding gums, a lot of cavities, loose teeth, bad breath may be signs of other serious events going on in your body. Not always, of course, but don't take that chance. Tell your dentist or hygienist as soon as you notice anything out of the ordinary. Your healthcare professionals will be doing the same, and together you'll make a pretty awesome team. Well, let's wrap up today's video, folks. I hope you learned something that you didn't know before. If you enjoyed this video, would you do me the favor of hitting that like button below, as it will help this channel grow? Feel free to leave a comment or question as well. Please consider subscribing and be sure to hit that bell icon so you can be notified of future videos on dentistry made simple. Bye-bye.